Healthcare, millions of Americans don't have it, and those who do are having a tough time paying for it. President Obama has outlined a plan for healthcare reform. The question is, how would it work, and would it work? Joining us is Congressman Joe Courtney, now serving his second term in Washington. Joe Courtney was also here in Connecticut hosting roundtables on healthcare reform just this week, and now you're here to talk about some of the things on a national level that hopefully will bring affordable healthcare to everyone.
Yeah, as you point out, Susan, I've been home with the July 4th break, and healthcare has been a big focus of the meetings we've had around the district. One at Wyndham Hospital with a lot of the providers, doctors, patients, and then the following day in Norwich at the Senior Center. And I mean, it's a good thing that members come home because they get to feel and experience what people are putting up with right now. The front page of yesterday's Hartford Courant had a front page story that Blue Cross Blue Shield Anthem was requesting a 32% rate increase for individual health insurance, which is already the most expensive kind of insurance in the market, and it's the part of the market where individuals feel the harshest brunt of pre-existing condition exclusions and high deductibles and high premiums. And yesterday in Norwich, a woman met with us who was 62 years old, had a heart attack when she was 54. It had been a family history. You know, obviously was taking very good care of herself. Her husband lost his job at a car dealership in the last few months or so, and she'd been out shopping around trying to find replacement health insurance. The lowest quote that she could get was $30,000 a year premium just for herself alone. And I share this with you because to me, there clearly are parts of the system that are badly broken. A self-employed individual should not, threaten themselves and their health by the fact that their economic and employment status has them out there without the help of a large pool. And if you look at President Obama's proposal, which is to create a federal purchasing exchange that would allow individuals like this woman in Norwich to basically buy her insurance along with millions of other Americans with real choices, private insurance, and a public option, that's the kind of change that I think really will help a lot of the people that are struggling so much in the system. For people who have insurance right now, group health plans, and like their insurance, as the President says, they'll get to keep it. We're not changing the ERISA law or the IRS law in terms of existing employment benefits. If you have veterans insurance, if you have TRICARE, which is the military health care plan, or veterans health insurance, again, those will be completely untouched in this proposal. And the focus here is trying to fix what's broken and really not try and overhaul and radically revamp the system.
Not to be too simplistic, but what do you see really is the problem?
Well, again, there's places where because the market doesn't provide a pooling mechanism for individuals, that really, again, discriminates is really the only word you can use for millions of Americans, particularly those with a chronic condition that are out there trying to buy insurance. I mean, it just the system just doesn't work for them. The cost issue is clearly a big part of the challenge that we face. I think the proposal, which again focuses on strengthening primary care and preventive care services, both within Medicare and also the whole healthcare system as a whole, again, I think is really smart measures that will help bring costs down to a better degree. And I think we need to look at the way Medicare reimburses to determine if there's a better way to save money. I mean, there's a great story in the New Yorker magazine 2 or 3 weeks ago, which the President referred to in a town hall meeting, about a community in Texas which has Medicare spending 3 times the rate of El Paso next door, Minnesota, New York, Florida. And clearly, there's high rates of utilization going on in some communities. Again, it doesn't change health outcomes. It's not like life expectancy or longevity was any better in that community. Obesity patterns, all of that. I mean, it's clearly just because the system permits this excessive diagnostic testing and overuse of the system. And that's where I think you're going to see a lot of focus in this measure, is that we've got to start getting some practice and incentives that are oriented to save the system and do a better job of providing care. You know, this is not going to happen overnight. I think if you look at the plan in terms of setting up the purchasing exchange or some of the changes about strengthening primary care, it's going to take a number of years for it to get phased in. And I think that, you know, there's going to be lots of screaming and yelling and, you know, sort of alarmist rhetoric out there, but at the end of the day, I think we can do this. I mean, we're you know, smart enough people, and we've got enough goodwill that we should be able to come out with a reasonable package that hopefully will get signed into law in 2009. I really believe this is a year, it's critical that we've got to get it done. If it slips into 2010 and we're back into election year politics, you know, we really risk losing the momentum.
Because at the rate that health care is growing, and I know even with some of the entitlements, it'll be more than we can afford.
Absolutely. And in my opinion, you can't fix Medicare unless you really sort of have a comprehensive fix to the system. And you're right. I mean, 17% of the economy now. I mean, that's twice as much as
we won't be able to pay for anything else.
That's right.
In the years to come. People really want choice. I think that's what we're hearing more and more from not just our viewers, but all over. And I think that's something that people are concerned about, that they're not going to necessarily get quality care if they go into some kind of government pool.
And I think that you know, it's important for people who have those concerns to recognize that we're not changing existing group employer-based coverage. It's going to be a multi-payer system. It's not going to be a single-payer system. I mean, there's frankly, you know, many sincere advocates for reform who are upset about that. They would like to see more of a single source of reimbursement and payment, but that's not what the President is proposing. And I do think choice really is one of the watchwords of his effort, and I think that you know, again, if you have insurance and you like it under this proposal, you'll get to keep it.
Why does the President need to spend billions of dollars to make it work?
Well, because I think there are parts of the system, particularly, for example, Medicaid, which is the program for the poor, where I mean, we know here in Connecticut, doctors and hospitals are paid in many respects only 50 or 60% of the cost of the care. And if we're going to eliminate this, you know, crazy cost shifting that raises the cost of insurance for private health insurance, then you've got to have some infusion of resources to bring up programs like Medicaid. And Connecticut will benefit from that, because under the proposal, we're not asking the state of Connecticut to match 50-50 the way we do under existing Medicaid. We're going to have the federal government step in and give a more robust level of reimbursement. So there are parts of the system where I do think we need to make investments, like Medicaid, like primary care. You know, we need to frankly educate more nurses, more pediatricians, more internists, and you know, for people trying to make those choices to go into those professions. I mean, the fact of the matter is we've got to make education more affordable, so that they're not coming out of medical school with, you know, high six-figure debt, and in which case they just sort of get forced into specialty care.
Finally, and quickly, how do you see prescription drugs fitting into this?
The proposal that we're looking at in the Congress would begin the process of eliminating the donut hole under Medicare Part D. I have to say the pharmaceutical industry stepped forward with a proposal along with the President to accept a higher, what they call rebate or discount, that the public programs would pay as a way of financing that reduction of the donut hole size. And you know, personally, I feel that's such an important issue right now. I mean, when a senior hits $2,700 of prescription drug expenditure under Medicare Part D, then they have to pay 100% of the costs of the prescription drugs until their expenses hit $6,000, which is, you know, I mean, who would ever design, you know, a plan
for
like
someone
this.
Living on a fixed budget.
That's right. And in the meantime, you have to pay monthly premiums for you know, a coverage that's not giving you any benefit. I mean, it's so narrowing the donut hole is going to be part of this plan.
Sounds like you have a lot of work ahead.
Now, this is going to be an intense 6 or 7 weeks. The House, our goal is to get a bill out of the House by August break.
Is this a bipartisan effort?
You know, I think at the end of the day there will be bipartisan votes on it. I mean, so far it's too early to say if it's really going to just completely break down. And again, we've only had committee hearings, and they've been well attended. And I think Republican members on our committee, because I'm on one of the 3 committees of the House that's taken this up, have asked good questions and have had a positive attitude. So I hope at the end of the day we're going to do this, you know, with more unity than you know, disunity.
Good. Well, thank you very much for
Susan,
joining us, and good
pleasure.
luck, and
Thanks.
we hope to hear back from you on your progress.
Okay.
Thank you.